I am focusing on the case of Tiffany Bradley and thinking of the issues at play here. There are a few different issues, but thinking of role theory, there are a few roles that Tiffany's in that are kind of causing the issues that I'm focusing on. So, one is Tiffany's role in her home and what that role was before she ran away and met Donald. And then again, her role as a victim of sex trafficking. That is a huge issue in this case. Tiffany's role within her family as a daughter, as a sister, and then Tiffany's role as an adolescent as well. All of these roles that Tiffany is in are kind of at the root of the issues focused on in this case. So going to slide 2, the roles of the client. Like I said, she has a role within her family. So she is a daughter, she is a sister, she is an adolescent, she's a female adolescent. In terms of taking care of her sister, she was the caretaker and the protector. It mentioned that in her case study as well. And then, like I mentioned, her role as a victim of sex trafficking, and her role with in her relationship with Donald. So she has a lot of different roles that she's in right now. Going on to slide 3, the social expectations and cultural norms. So the role that I focused on was the role of Tiffany as an adolescent. And there are a few things that I saw that were kind of like the social expectations or the norms for adolescents in our society. One, for an adolescent, is having some sort of self-concept or some sort of identity. This is kind of the stage where they're developing their identity. And I found in this piece of literature that that's often influenced by peers. And then going off of that is feeling a need to belong. And this is obvious in the case with Tiffany and her relationship with Donald, that she feels that need to belong or to have a role in that. And then she also looks for reinforcement from others, which is a norm for an adolescent. And that's something we see in this from Tiffany as well in her relationship with Donald. So going on to slide 4, the role and position of a social worker used in this in a framework of role theory. So social workers are in a professional role, and because of that, they have rights and responsibilities as a professional social worker, and are often seen on a higher standard and have higher expectations upon them. Like I said, they have expectations on them, so they're expected to fully assess for harm that is being done to clients, and then they're also expected to be open and honest with the client about their roles and the client's role and what the professional relationship will entail. So this goes into confidentiality, what they can and will not report, and their ultimate the ethical boundaries that they have to abide by. So then specifically in this case, going on to slide 5, the relationship between the client and the social worker. Like I mentioned before, social workers are often seen as a higher social position than clients. It was mentioned in the Turner text that it actually used an example of exploited youth, that social workers would be in a higher social position than a client, such as an exploited youth would be. So in this relationship, both of them must be aware and acknowledge the difference in role and positions, and then approach the presenting issues from the role of a social worker, but also making sure that the client is understanding of the relationship, just to build the trust and to build that rapport between the two of them, and to understand their roles and what they're expected to do and what the social worker's expectations are of the client and the client's expectations are of the social worker. So then going on to slide 6 and thinking about assessment questions, I kind of thought of these 3 questions looking at the Turner text about what her responsibilities and roles were in the various relationships that she is in or she was in. So the first question I asked was, what do you feel your responsibilities are in your relationship with Donald? So that's kind of going into what her role really was in that relationship. It says in the case study that she claims to be his wife, and so digging deeper into that, what was her role in that relationship really like? And then the second question was, when you were living with your family, what do you feel your responsibilities were in the home? And so, like I mentioned earlier, I mentioned in the case study that she kind of became the protector or the caretaker of her sister. And so digging deeper into that with her, to see where kind of her head is at, of her understanding of what her role was in the home. And then the third question of what role do you hold that you feel is most important? So whether that's her relationship with Donald, her relationship with her sister, or her parents, kind of those first two questions kind of get her thinking about what her different roles are, but then what role is most important to her, whether that's in her family as a daughter or as a sister, in her relationship with Donald, in the various, like I said, assessing the various roles that she is in. So thinking of interventions that could be effective in this situation, this first one I read in the Turner text is family therapy. And it mentioned the idea of a parentified child. And that was kind of the case before Tiffany ran away. Like I said, her parents, it was mentioned at the beginning that her parent, or her mom especially, used to keep a clean house and everything was put together, and her parents started drinking and things like that. And so she really did become the protector of her sister and felt like she had to take care of her sister. So family therapy would be digging deeper into discussing the roles of a parent and the roles of a child, and what is expected of a parent when they are taking care of a child, and what is appropriate for a child to do. And then the second one is role play. And I found this one in another piece of literature, but something that I found interesting. So role play gives a social worker and the client, especially the client, the opportunity to kind of act out what they feel their role is. And this helps them focus on attitudes and experiences, and kind of how they perceive their world, or what they want their world to look like. It depends on how they approach it, but it kind of gives the social worker an opportunity to help the client focus on their roles in the different relationships that they're in, or the different roles that they play in society, and how kind of they perceive that. So then thinking of measurable outcomes, I focused on the family therapy intervention, on the parental roles and the roles of the child. So measuring this as our work, or as a social worker continues to work in family therapy, assessing what responsibilities do Tiffany and her sister have, and versus what responsibilities do Tiffany's parents have. So has that changed, or what are Tiffany's parents, what do they perceive their role to be now, taking care of Tiffany and her sister if Tiffany would go home, or what do they think is reasonable for children to do versus what they need to do to take care of the children. So measuring that, of measuring progress in that way of, do the parents see the need of taking care of the children, and do Tiffany and her sister have an understanding of what their role is as children, as adolescents. So there are both advantages and limitations of role theory. I think advantages, it helps the social worker to understand the client, and that kind of goes into like role play, like I mentioned earlier, but it helps them see what the social norms, I guess, or the cultural norms that are expected of a client. So thinking about all the different roles that they're in, like, for example, it helps to understand Tiffany, knowing that she has a role in her family as a daughter, as a sister. She has a role as an adolescent. So it really kind of gets a bigger picture of the client and what's all influencing her as she develops. This also might help help the social worker to see how the client might view themselves in their roles, what their values and responsibilities are, And like I said, this can go without even the client explaining it, but there are some certain things, like I said, like a daughter or a sister or an adolescent or things like that, that kind of help the social worker right off the bat, kind of see the responsibilities or the expectations that might be on her in that certain role. And then, like I said, measuring whether or not they're meeting those expectations or norms of that role. But then limitations of role theory. It maintains social cohesiveness, which can be an advantage or a limitation. So then you have to ask yourself, who creates these social norms? And according to the literature, it's often people in power. So this promotes people to conform to society and what society expects of them, rather than change, and rather than understanding that individuals are individuals and they can't always be conformed to one another. It also implies that there's a normal behavior or a proper way to live. And as I mentioned, it discourages change and does not encourage people to be individuals, or to not necessarily go with the norms or what society is expecting of them.